I still want to encourage you, please continue subscribing to our YouTube channel, Big God TV, and continue sharing with your friends so that we all benefit. We don't leave out anyone. So today again, as a brief preview, I want to remind you, we are talking about sickle cell disease. And this is, it is also a disorder that affects the hemoglobin, and the hemoglobin is a molecule in the red blood cells. So basically, sickle cell disease affects the red blood cells. And I want to remind you, the red blood cells are the ones responsible for transporting oxygen to the whole body. So that is what we are talking about today. And last time we were able to get to know what it is, how it comes about. We talked about the parents, how it comes about, and we also got to know that sickle cell disease is genetical. It is not a communicable disease, but it is genetical, and it is got both from the two parents. Two parents have to have the genes, and so that is how the child gets to get the sickle cell disease. So with that preview, if you were not watching us last week, that is what we briefly talked about. And today we are continuing. We want to look at the signs and symptoms of sickle cell disease. And today again we shall be looking at how we manage patients of sickle cell, and we shall be talking about how it manifests right from the young children, the infants, the adolescents, the adults, and we shall, if possible, we shall also look at the complications. So today we are going to go through quite a number of things. So I encourage you to keep reminding your friends about the video. Watch with your friends, share on your posts. So Arnold, thank you so much for joining. Thank you for letting us know that you're watching. So if you're there and you're watching, please let me know that you're watching by sending me a wave. Send me a hi so that I can know that you are watching. And I want to see you keep sharing, share on your posts so I can know that you love me so much, most especially that you love the program and it has benefited you. So, having known what sickle cell is, what are those major signs and symptoms of sickle cell? Well, I'll talk about fatigue as one of the major signs of sickle cell disease, and also anemia. And you'll find that that patient presents with painful crisis, and the patient will also present with inflammation of the lower limbs and the upper limbs too, and will also present with a history of frequent bacterial infections. And this patient also will present with frequent low hemoglobin levels. For example, if this patient usually goes to the hospital, you'll find that whenever they do a CBC, a blood count, you'll find that this patient always has a quite low hemoglobin level. And this patient also will have the lung and heart injury, depending on the severity and the stage of the disease. And this patient also, depending on the age and the age of the patient, will have the leg ulcers, and also will have a bone infection, a septic necrosis. So these are the major, or what you call the cardinal signs of sickle cell disease. So as a medical worker or as any other person, you have a child and that child is presenting with these kind of symptoms. I'm not saying that sickle cell is the only one that presents with those signs, but these that I've said are the major signs or the cardinal signs of sickle cell disease. So if you have someone an adult, an adolescent, a child, a baby presenting with these signs, then you have to seek medical attention so that when you go to hospital, probably you are able to be attended to, and you try to ask questions. I encourage everyone, your parent, your caretaker, please do not fear to ask the health workers, the one taking care of you, what am I suffering from? How does it come about? How does it present? Or if you have any sign that you're experiencing, ask, why is this so like this? Why am I feeling this? Or why is my child presenting like this? So it is very good to be really so curious about everything that you do, because ideally you have to be normal and not have any of these signs that I've talked about. So if you have someone presenting with these signs, and then that is when you start questioning yourself about sickle cell disease. And earlier on last week, we said for you to know your genotype, you go to hospital and you are tested. You get to know your genotype. You get to find out whether you're a carrier, you are a sickler, anything of that kind. And remember, I said sickle cell disease is genetical. 2 genes have to come from both parents, and then the sickler is born. So it is not a communicable disease. So we've got to put that in mind, especially when we are starting to starting relationships that we intend to go on further and to maybe spending a lifetime with your partner. Those are some of the things you have to look out for. Do not only look at HIV. Please also try to find out your genotype. It starts with you, then that is when you get it to your partner too. Because to some people it may be quite hard to understand. But if you've understood and you get to know your genotype, you get to know when we go ahead, you'll see that the signs and symptoms that these patients are presenting with are not really signs that are pleasing. And you'll find that this patient is having on and off painful crises. I'm telling you, it is not nice to look at someone suffering with this pain. So just imagine you are that caretaker and someone is crying and you cannot do anything to help relieve the pain. So we have to put this in mind, especially if you're in that position that you can try to advise a couple partners intending to spend their lifetime together, and also you as an individual, you are in position to take the lead and then get to see that you know your genotype. So at any stage, any age of that person, do not forget that this person always have fatigue. Fatigue is feeling tired all the time. All the time you are tired at all the time, and you feel so like your body is all paining, and you feel like you can't keep going. If you find that you're a casual laborer, you find that you wear out so easily, and yet you've not done so much work, but you'll find that you're so tired compared to the kind of work you've done. And you'll find that these patients also present with anemia. Anemia is having low blood levels in your body. And this person will also present with bone infection. The bone infection may go as far as the necrosis. It might be mild depending on how the patient has presented and at what stage, because some patients really keep at home for a long time before they even come to the hospital. So depending on how and when the patient comes to the hospital, Those are the cardinal signs of a sickle cell patient or a sickler. So we shall also look at how the infants present, the young children. You'll find that this child will always have fever, and this fever comes along with a lot of crying. Well, sickle cell in some of the countries is confirmed at 6 months of age, but it is unfortunate that we get to lose these children sometimes before they are even diagnosed, because these kind of signs and symptoms tend to come in as early at an age of 2 months, and you'll find that at times the health facilities they go to never really get to find out or help them, like diagnose them in the right way or make a right diagnosis for them. And the mere fact being that they are very young, most cases, if the parents had been carriers, they had never heard of sickle cell in their families, it is something that one may really not think about so easily. So some of these children are really so unfortunate that they get to lose life before they are even diagnosed, because any mismanagement of any condition may not really lead to a good prognosis, may not end up well. Sometimes some people are lucky and are managed asymptomatically and they get better, but it is always good that you get to find out what your child is suffering from, or what the person is suffering from that you're taking care of, or what you're suffering from, because it may be you. It may not be someone else, but it may be you. So it is always good to ask questions. Why am I having headache? Why am I having fever? Why is my child always crying? Because if it is a child, the only way the child communicates is by crying. So you don't expect this child who doesn't know how to speak to do anything, but he or she will cry just to show that there is something wrong, there is something he or she wants. So fever is something that you really have to look out for when you're handling a young child or an infant. Then the second thing is abdominal pain. In these young children, you'll find that the child is always crying, and you'll find that most of the disturbances are abdominal pain. And if this child is at an age of 1 year or 2 years, we'll be able to tell you my tummy is paining, or will be holding the tummy, trying to show you that they're not really doing so well. So you've got to look at these infants and then be critical enough. Look at the child, know when the child is okay, know when she cries in this way, when she like this, what does she mean? Try to study this child that you're with, so that you get to find out if it is abdominal pain. We've got the fever, the child is always so sleepy, and some of them may even go on and have jaundice with them, sometimes because of the low blood count, low HB, but sometimes it may be just another symptom also. The child is yellow, and these are some things you have to look out for. So another thing is, when you go to hospital, you'll find that the doctors or anyone talking to you, taking care of your child, will always tell you your child has a pneumococcal infection. This is something that should also be given attention. Your child is always having fever, has the abdominal pain, the pneumococcal infection. You've got to really take attention. Please pay attention to whatever the doctors tell you. If the doctor says it is a pneumococcal infection, ask the doctor, so what should I do? Why do you think it is coming about? What else can we do? Let us not limit any health worker to think for our children. Remember, we are looking at the infants. Those are the ones I'm dwelling on with these signs specifically. Eyesight fever, abdominal pain, pneumococcal bacterial infections. Look out for that too. Take it to be serious. Monitor your child. Give your child attention. Know when they're fine. Know when they're just hungry. Maybe they're crying because of hunger. Of course, when you feed them, they'll just, start laughing and smiling. But if you see that your child has, the nappy is okay, he has eaten, and you taken a shower and you feel that you've tried to make the child comfortable, child is still crying, try to go an extra mile. So, as I said before, you've gone to hospital and you've been told your child has a pneumococcal bacterial infection. Please try to ask questions. Be curious enough and find out what could be the cause. If it is avoidable, then that would be for a better cause. Avoid it so your child can be healthy. Then you'll find that these infants will have pain in their joints and probably they will swell. If this child has been able to walk, you'll find that they feel pain or they cry, they don't want to stand. You'll find that they're uncomfortable walking, coming towards you, and they have the urge to come closer to you, but they actually can't reach to you because of the pain they have in their joints. And when you look out for at the joints, you'll find that these upper limb joints will be swollen, and even the lower limbs at the ankle. You'll find that those specific areas will have started swelling. So you'll also have to look at that. So when actually you reach the hospital during examination, you may hear the doctor say, oh, the spleen is quite enlarged a little bit, or even so much, depending on the severity. So you also have to ask questions. Like I said earlier, ask questions. Please try to find out. Ask the doctors, why is this happening? Why is this coming? What does it come about? Where does it come from? Because this is a child who cannot ask questions. So you have to be in this child's position so that you kind of ask questions for this child. So as a parent or as a caretaker of any child, may not be your child, but you may be the caretaker. So please look out for everything of that kind. You'll find that this child is always weak and always thirsty. This patient will also have a pale skin. If you be very critical, if you've ever taken care of a sickle cell patient, you find that they are always thirsty, and you'll find that whenever they take lots of fluids, they feel much better, they feel refreshed, they feel nourished. So that is also something that you may have to look out for. I'm not saying that if you're taking lots of fluids, you have sickle cell. That is not what I'm saying, but on top of the cardinal signs, these are other things that come along with the cardinal signs. Someone with a pale skin could be due to anemia, could be due to any other thing. And if it is a child, you find that due to the high fevers, the HBs are quite low. Of course, the child will have a pale skin. So that is something that you have to look out for. And if this child is an adolescent, you'll find that this child will have a leg ulcer, will have a wound, and it may even produce proceed to even be going to the bone and start affecting the bone. And this may also go ahead and become a damage to the bone, may even bring other complications. This child is also going to present with aseptic necrosis. That is especially for the adolescents. You'll find that they are always weak. They don't have so much energy that to sustain them for long during any activity. They'll complain of chest pain, and if you're close to them or you look at them when they're in the crises, you'll find that their heartbeat is quite fast and they have shortness of breath. If this child is able to speak, they'll also tell you, I'm having headache, I'm feeling so dizzy, and you'll find that they're also feeling thirsty. And when when you come close and touch this child, you'll find that the legs and the feet are always cold. Now, this is also something that I'm not saying is a cardinal sign of sickle cell, because some children actually have cold feet and cold hands, but this is just another symptom to add on the cardinal signs, to add on the major signs. So when you critically or go ahead and examine this patient, you'll find out that this patient has brittle nails and also has soreness on the tongues. Now, that is if you've been so critical with this patient during your examination. If it is someone you're taking care of, for example, if you are not a medical worker and you found someone sick, you've gone to check on that person. These are some of the things maybe you could keep interacting with this person and then pass on the information, encourage this person to go to the hospital, because some of the people don't actually want to go to hospital. Please go to the health workers so you can always find out what it really is. I know we have Google. You can always ask Google. But it is more trustable when you try to explain to someone physical to you who can help you, like answer some of the questions that Google may not answer, because you may fail to term something for Mr. Google and yet I could understand it better for you. So please, it is good to read. I'm not discouraging you. Please go ahead, keep reading, but also find someone who is trusted. Find someone who is trustable, not because of their looks, not because of how long they've worked there, but is this person trustable? And we are talking about health. This is not something you can easily repair. Health is health. You can never repair it. So please, find someone you can trust with your life, with your child's life, with your relatives' lives, so that they don't just play around with it. Find someone who can think for your patient, so that if this person presents with all these signs, please go ahead and ask questions. And if you find that this person is not really so open and so free to answer you, then you have to look out for someone else, because ideally you meant to answer every question that I ask. So please, at that point, I want to remind you to keep sending your messages, ask questions, add on anything you feel like you want to add on, something you want to compliment upon what we are discussing. Do not go off topic. And in the next time, I'm going to be reading out the questions and I'll keep on answering them. Do not forget to share with your friends so that they also get to learn this. You never know, you may help someone out there who is suffering with this and did not know what they are suffering from, and they could benefit from this program. So please keep sharing, keep liking, keep asking questions, anything you want to ask concerning the program. And I want to remind you, you are watching Big God TV. We are based here, or we are broadcasting right here from Turkey at Sarai Kumkapi, and we are based at Big God Church. And as we want to continue, you'll find that these patients during the crisis, you'll find that they'll always have the dehydration. Now, dehydration is when someone actually presents with maybe a pale skin but to be dry, and will have a feeling of thirst if it is an adult. For the young children, you'll find that if a child presents with dehydration, they will have sunken eyes. The skin pinch will be so slow to go back. The skin will also be dry even when you apply oil. So dehydration is also one of the signs that a person will have during the painful crisis. And this is something that also increases the chances of this person having the crisis. You having a patient who has been diagnosed with sickle cell disease, please, this is something you have to avoid. This patient always has to be rehydrated. He or she has to be fully rehydrated. Take lots of fluids. We encourage them to take ORS wherever possible, whenever possible. A sickle cell patient should always have a bottle with them. So right now we are going for a short break and we shall be coming back. Please keep watching Big God TV and keep sharing. Comments on Facebook, I'll be reading them, and I welcome all the questions that you have. Thank you so much for watching. God bless you.
The bad news is that everyone is a potential victim, but the good news is that everyone is a potential solution. Sensitize the masses to sanitize.